I've been seeing a big push, especially by Bernie supporters, calling for a single-payer system. I argue sometimes that a public option is better, with so many Americans deathly afraid of government intervention and raising taxes needed to fund a single-payer system. While having this discussion, a person I view as very knowledgeable on political issues was completely lost on what a public option is. I even had someone block me because he thought I was being wishy-washy and trolling him. I thought everyone knew what the public option was, as it was discussed during Obamacare, but I guess many weren't paying attention to politics during that time, or there was too much going on to take in. Single payer is what the British government has, along with several other nations. Everyone pays taxes and gets equal health care. The cost overall is much cheaper through efficiency and economies of scale and the ability to negotiate costs and get the lowest bids from contractors. However, it does reduce some choices and raises taxes. Public option, on the other hand, is a government-run, non-profit insurance company that can service everyone across the nation. Also, thanks to the economies of scale, microscopic overhead, and no profits, a public option would be way cheaper than any other insurance company we have right now, just like how the post office works. I have a two-part video I made a while ago discussing how public options actually increase innovation. We already have what is essentially an insurance company. It's called Medicare, which at the moment is a single-payer system for the elderly. Medicare already has a huge risk pool, bigger than any insurance company out there, and the infrastructure to pay out payments. The only difference between it and an insurance company is that the government pays all the premiums, deductibles, and payments. If we allow people to pay for their own health care through Medicare, as Alan Grayson proposed a few years ago, people would still have the choice of other insurance providers, which they like, while at the same time, no taxes would have to increase. This is the next step the ACA was supposed to take, but couldn't be implemented at the time, thanks to the fact that we were in the middle of a recession and insurance companies employ a ton of well-paid workers, as I discussed in the video below. So Obama built the marketplace structure using the Heritage Foundation's plan and set us up for this next key step. One other downside to a single payer versus public option is the harsh economic impact it will have due to taxes and destruction of many jobs, so it will have to be implemented over a decade or two. Massive tax increases and massive loss in jobs in insurance could cripple the economy. An advantage of public option is there will be zero tax increases. People will see Medicare insurance as a much cheaper option and switch over on their own, and the people who fear government could pay more for private insurance out of the principle, the way many liberals don't want to shop at Walmart. The problem a lot of people have when explaining this to them is their inability to view Medicare as both an entitlement program, which is single payer for people over 65, and also act as a non-profit insurance company. It could easily be both. They just have to do some math to determine pricing, then staff up billers, and public option is ready to go. So many people are stuck on the idea of single payer, ignoring or oblivious to the political and economic reality that we have to phase people in over 2 decades while continuing to raise taxes, or we can let people pay for their Medicare much cheaper than they would pay for regular insurance and raise no taxes and have a slow bleed of insurance companies as opposed to a sudden death that could shock the economy. Then we must give Medicare the power to negotiate down prices, as without the government artificially creating these customers, these drug and medical device manufacturers and hospitals would not be able to make as much money. Their economies of scale should not translate into more profits for shareholders because of government intervention. It should translate into better, cheaper services for the individual like they have in all other Western powers. And speaking of Western nations, many, like I believe Germany, use a public option system as well, and they still spend less and are healthier than us. Single payer is a good option when public support is behind it, but when 1/3 of the nation fears the government when it does anything, a public option is a system that also works just as well, as even if we decide to expand single payer, public option would help those waiting to get absorbed into it. Thank you for watching. Please like, rate, and subscribe. Also consider donating to my Patreon account. My WordPress blog today discusses something I've run into many obviously wise people claiming that they're tired of spoon-feeding and they're done hand-holding conservatives. If you want real change, that's absolutely impossible, and we've all been spoon-fed at some point. Thank you.